Hey guys, Evan's here with
Shekinah.
Nice. She's our stretch therapist here at CNU Fet. But from CNU Stretch, I want to talk over or answer the question that Keenan asked about clients with back pain. What do you do? So let's turn around real quick. First thing we want to do is assess where is the back pain coming from. Is it really their back? So a lot of times, people say it's my lower back. I'll ask them, is it the left side or the right side, or is it goes all the way across? Next, I want to find out, did they have an injury, or I got into a car accident, or I had a ruptured a disc, or things like that. Typically, the way your vertebrae are, when you rupture a disc, it typically slides down one side, it's not both. Kind of like when I ruptured a disc, it went down my left side and impacted my left side of my body, not my right. But I want to find out some of those things. Thirdly, I want to identify, is it really their lower back? Remember, where a client says that they feel the pain, it's not always where the cause of said pain is, excuse me. So I want to figure out, is it the lower back, the QL? The QL muscle is responsible for going like this and like that, right? So that's the QL muscle in there. So I want to figure out, is it a QL problem? Is it a glute med problem? Or is it a glute max problem? So first thing I want to do is have her lay down, face down on the table. And maybe the challenge is her, or is it coming from the hamstrings? Because the hamstrings can cause, the lower back to have some issues. So what I would do is do a quick assessment. And what I'm gonna do is take my pinky finger and put it right on her bicep femoris. So that's that outside hamstring leg. The pinky goes there. My thumb will go on her glute. On my other hand, my thumb goes on the glute, and my other thumb goes on her lower back, really close towards the QL area. And then I want to see her lift her leg. So I'd like you to just lift the left leg. Okay, she bent her knee, so clearly my cueing was not right. Keeping the leg straight, let's start all over. Keeping the leg straight, what I'd like you to do is lift the left leg. And what I'm feeling for is, where did I feel tension first? Bring the leg down. Now, did you feel where you felt the resistance against me first?
The first finger.
So this finger here? So that's telling me, and I felt there as well, that her hamstrings are firing before her glutes fire. So we have this situation where her glutes are not what we call turned on, is kind of like gym talk, but basically her glutes are not firing first. So that could be contributing to some of this low back pain if she was someone with low back pain. So this is an imbalance or a muscle weakness. And a lot of times this happens because people sit a lot. You have your knees, your hamstrings are bent. Hamstrings are known to be overactive, while the glutes, which is really important, is known to be underactive. So that's what I look for initially. Now, there's a lot of common causes to this. It could be anywhere from a postural imbalance, anywhere from a pelvic tilt. Somebody has a lordotic curve like this, or they have the posterior, the posterior pelvic tilt like this. That could cause some of those low back challenges. It could be leg length, right? Someone, and that's something that there's some stretches that can assist with that, but maybe someone's leg is longer than the other leg, so they're walking off balance. It could be scoliosis in their spine, so that could be the cause of it. It could be just straight weakness, as we discussed earlier, where one muscle is just weaker and other muscles are taking over, causing this muscular imbalance. A lot of times it's going to be, if it's in the weakness, it's going to be the glute med, which is this muscle right here, is responsible for hip extension, right? So this is flexion and this is extension. So responsible for hip extension and exterior rotation, right? So the glute max is responsible for that too. And if those are weak, then other muscles will take over to help compensate for that. It could be a core issue, so that's going down the leg. It could be a core issue where we have a muscle called the transverse abdominis. So some people say your TVA muscle. And basically, if you think about it, it's like the internal girdle. So it's not something that you can touch like this here. It's a deep muscle in there, and it helps stabilize your core, specifically your spine. So it could be that. It could be your glutes, where one glute's stronger than the other. Obliques. One oblique is stronger than the other oblique in there. Or it could be the multifidi, which is this muscle here. It runs straight up the back, and these muscles could be weak, all causing the QL, which is a real common cause of pain. for people that they think it's their low back, but it's a deep muscle. So if I go like this here, I don't really feel it. I gotta really dig in, you know, like right there. She has such a short area, right? I gotta really dig in to feel that QL muscle in there. So just under the ribs, just lateral of the spine is that little space there, but it's a deep muscle, but it could be that. It can be overuse. If it's QL dysfunction, it could be overuse from sitting, a lot of unilateral things that somebody does, all those kind of things. And then ultimately compensation patterns. We don't talk a lot about this with stretch therapy, but one of the things that can really help people if it is a QL dysfunction, help them is just teaching them how to breathe well. So a lot of times I'm gonna actually flip you on your back real quick. And I'm gonna have a relax. Actually, this is perfect. Put your hands back on your stomach, and I'd like to see you take a breath. And you can see when she took her breath, her chest went up and her stomach went up. But ideally, so you put one hand on your stomach, one hand on the chest. And we don't want any movement at the chest, only breathe through your stomach. So when you inhale through your nose, the stomach rises. That's a diaphragmatic breath, not your chest. So this is really challenging for her. So we can kind of cue the client, they can work on their breathing. They can practice their breath as we do other stretches that target the muscles, but we want them to have no movement here and then just push as you inhale, push your belly button against your hand. The other way. Yeah, blow that belly out. Think about how babies breathe. They blow their stomach out, and then when they come in here, but no movement should be up here at the chest. And clearly this is something that she's having a little bit of challenge with, so we can give her this as homework to do, work on what's called a diaphragmatic breath. She can do it this way, she can do it with her knees bent as well. You know, there's some stuff that we can do to help with that, but it could be a breathing situation. Other things could be like just a, you know, chronic pain due to a car accident or something else. Another big problem that affects the lower back is your hip flexors. So you have your iliac psoas, your psoas. This muscle goes here, up or over the femur, through the hips, through the back, and connects right here in the lower back around L3 and lower. You know, so that's something that if this muscle here, now if you're in massage therapy, you go in there, you dig in, you feel that bad boy.
Yeah.
That's the love. It's painful. That's not our jam, you know, but you could dig in and grab that QL, that psoas and do it. Instead, we could just do psoas stretches for that. But it could be an overactive psoas because we live like this. You know, that's how most of us live our day. And so that can cause that muscle to be overactive, causing back pain. So let's talk about solutions and stress. You know, we talked about it in the certification for level 1 and 2. Our body does hold stress. So it could be where someone is holding stress in their body and where they're feeling it is in their lower back. You know, so how do we even do that? A lot of the same techniques we'll do to go after things that's muscular is neuromuscular, right? It's going to hit the fascial system. It's also going to hit the nervous system. So if she's just working on getting that diaphragmatic breath, then it can help. So let's start with the breathing and then finish off with, you know, some stretches and maybe some exercises to do. So we're looking at breathing, hand here, and then what I want you to do is as you take a breath in, you're going to take it on a 4 count, and for 4 seconds, you're just going to push your belly button up towards your hand as you take a breath in. So inhale, breathe, breathe, breathe. Can see, yes, there we go. Hold, 1, 2, 3, 4. Blow out the mouth and squeeze the belly button into the spine. 2, 3, 4. Hold, 1, 2, 3, 4, and breathe in. Blow that belly button. 3, 4, hold, and we can go through that and teach her some diaphragmatic breath. We can either tell her when she goes exhales, push that lower back into the pad to help. Now let's say someone has a big butt and they can't do that, then you just have them bend their knees, so bend both knees, and that's going to allow their hip to do that pelvic tilt, and they can go through this exercise as well. You can even take this up a notch and do what's called 90-90. So lift your knees up here, and this is something someone would do at home with their feet against the wall like this, and they'll just practice breathing. So that's one. The other one's called crocodile breathing. So I'm gonna flip onto your stomach. And you're gonna have like your head in like this here in there. And what she's gonna do now is when she inhales, she's gonna push her belly button as hard as she can into the table. And then when she exhales, she's gonna pull her belly button out of the table. So she's gonna inhale, pushing that belly button towards the table. And you exhale like forcefully for 4 seconds through your mouth. So the inhale's through the nose, the exhale's through the mouth, and this is gonna be a little bit forceful in there. And she's gonna lift, like literally lifting her belly button off the table. Inhale, pushing into the table. Exhale, lifting off the table. And this is something that someone can do anywhere, but it just teaches them how to breathe and starts getting that internal stability. As far as exercise, since we already have her in this position, we're gonna go quadrupeds. So you're gonna have hands under your shoulders, knees under your hips. Hands under your shoulders, yep, knees under your hips. Bring your knees up under your hips. Bring your knees under your hips. Bring your knees under your hips. Cool. Yeah, beautiful. So now she's in what's the quadruped position, and we want to have her do a bird dog. Depending on the level of advancement of your client, determines where you're going to start this. Let's start with the super novice, and again, somebody can do this at bed, they can do it at home, on the floor. I may say, hey, what I want you to do is tuck these toes in towards you, beautiful, and I want to get that initial activation. So as you tuck your toes in, almost think about like your heels are pushing against there, but keeping everything in the same place. I want to keep this core stable, and I just want you to lift that left hand without any movement else in your body. So lock in your core, lift that left hand up, beautiful. And I may have them do that if they're brand new. Let's do it on the other side so they can see it as well. No movement anywhere in here. Beautiful, in there, and that's one rep. And I may have them do 10 to 15, 2 to 3 sets of this, right? And then I'll say, hey, the next thing I'm gonna do, no movement. What happened there? No movement, keep that core engaged, squeeze that belly button in here. You should feel like you're bracing for like someone tickling you in here and still be able to breathe. So that's your core engagement. You're bracing, but you should still be able to breathe the whole time, right? Now keeping no movement here in the back, I want you to just focus on pushing this heel straight back behind you as if you're pushing the heel into the wall. This heel comes up and back. No, the toes stay the way they are. And kick your heel, kick your heel out back. Yep, straight back, squeeze your quads and your glutes. So your glutes are totally engaged, beautiful. And then bring it back in there. And don't tuck this, keep the toes, yep, beautiful. And then just do that again. Nice. And I want you to do that until you have nice stability and not rocking over. So let's try that again, here. Yes. Do you feel the difference? Where last time you were shifting your weight, but this time you're keeping it this? And it's simple. Until they master this, I see so many trainers immediately, they go to arm and leg. And the client hasn't gained stability. This is not a strengthening exercise. This is about building, hip and core stability. Once they've mastered that, let's assume she has mastery. Now at the same time, the right arm, the right arm and the left leg are gonna move out. So act like someone's pulling you apart, but you're using your core to keep them from grabbing you. Beautiful, and then bring it back in. And you see how she kicks over there? We want to do as much as possible, trying to keep the hips leveled, and go ahead and do it again. It's a lot more challenging than it seems, and make sure that core is nice and tight, like someone's bracing you. So these are your bird dogs. Let's flip onto your back. These are just homework assignments because it was asked, and I think it was really cool. And I may take, if this is a 50-minute stretch session, I may take 3 to 5 minutes to show them how to do some of these things, and then it's things that they can do at home. So then now you're gonna go in the reverse position. So you're gonna be 90-90 here, and then your arms are straight up above there. Same kind of thing. The first thing we do is make sure we're working on our breath. So we're breathing through the belly, push that lower back into the table. Yes, we want to maintain that back into the table. And then the first thing we'll do is we'll go leg first. So we're gonna do the left leg is gonna go straight out. Beautiful. Now we're gonna maintain dorsiflexion, which is like this. Here, what happened? Let's get that back into there. Core is engaged. Give me dorsiflexion. Beautiful. 99. No movement on this side. No movement up top. Only this leg goes straight out, out. Squeeze that quad. Beautiful. And then bring it back in. Now you notice that we lose 90-90. So let's focus on keeping 90-90. And then go ahead, go out again. No movement on this side. And this doesn't stay up. It's going to come straight out here like that. And then bring it back in. So yeah, it's a little bit more challenging than it looks, right? And then we're gonna keep it here. You got it. Nice, that core is engaged. And then we're gonna bring an arm back. So pick an arm and then go back. Beautiful, no movement anywhere else. Good job. Now, and then you can do opposites. So since you already did those 2 sides, we'll do the other 2 sides and go opposite same time. You see how this one hiked up? We don't want to do that, so let's do it all over. And I'll cue the client real quick and then know, okay, I want to bring awareness in there so that they can do this as their homework when they leave. So let's go again. Nice, a little bit better, less hiking in here. Beautiful. Now let's say you have a client that's a little bit more advanced, which probably won't have to deal with this. Come on, let's go back up here. She's loving this, hands straight in the air. And then they're gonna give me a mini crunch. Beautiful. Just a mini one because you're gonna hold this position, and then now do your bird dog, maintaining the crunch. Yeah, a lot. Yeah, that's just the love face that she's showing. Cool. So that's one exercise. Even before that, like from this position, let's say we're gonna regress it a whole lot. We just work on pelvic tilting. So from here, you're just gonna shift your pelvis. Yep, beautiful. Hold, and make sure they practice like maybe 3, 5, 10-second hold to get that feeling. So you feel nice little stretch there. You feel your your core completely turn on, and then relax, and then you can work on pelvic tilts. Other things we can do is our QL stretches, right? So we have the list of them in the book, but one quick one, relax here, down here, and this is the banana. So we know we can do the banana, nice QL stretch, right? Beautiful, we can get that stretch in there. That may hit a little bit of QL, may target too much of the TFL, just depends on where the person's feeling it. If they're not feeling a lot there, we have the QL quick push, pull. So we can have them sit up, face the camera, and you come right next to the client. If you do Amanda's way, you're gonna sit, and this hand goes on top of the head, next to the head, beautiful. You sit right next to the client, you grab here. Now remember, this person has back pain, so we don't wanna just go, whoo. You know, we wanna like guide into it. So we come in here, we feel the stretch, 2, 3, reset, and then go right back into it. One of the things I do recommend you guys do is don't reset like this. You know, that's just weird. So get in there, beautiful, come all the way back up, sit up nice and tall. Let's fix your posture, beautiful. Hand on top of the head, and let's go right back after it. Beautiful. So that's one there. The other one, you can have them have hands behind their head, right? And then we can go after the twist and dip. So we can come here, and typically I do this from the edge of the table, but we'll just do it here for our purposes. We're gonna twist, yep, and dip. Nice, 2, 3, beautiful. And we'll do it again. No, you're so excited about the dip. Let's twist first. Twist and dip. Nice. And you should feel that right here in your lower back. Cool. And that's the little QL stretch. Other exercises you can do. So we talked about, you know, all the ones I did before are all about core stability, hip stability, getting the core to be stable. And a lot of times the instability in the core causes them to do a movement and then their back hurts, so to speak. But maybe it's a dysfunction in their movement pattern. So like with her hamstrings are firing before her glutes. How do we fix that? Lay on your side facing the camera. So then we start doing things like clams, you know. So we come up and we have them do clams. We teach them how to do a clam. We're gonna stack your feet, take your big toe, come on here. And this just kind of turns off your hamstrings from assisting in some of the exercises. And then lift that knee. Keep on lifting, lifting, lifting. I want you to lift until you feel like you want to turn open, but don't go there. Don't open it up. So come on up. And because we're working with stability, not strength, what we want to do is hold here. So you want to hold it for a 4-second count. 1, 2, 3, 4, and then reset at 2-second. 1, 2, back up. Up, 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 squeeze that. And you need to feel the glute. Hold, 1, 2, 3, 4, reset. So this is stuff that you can have them do at home, you know, or you can bake it into their workouts or their warm-ups if they come in pre-workout, because this is gonna get the glute activation. Basically, come up one more time. When she's doing this hold, her whole nervous system is saying, hey, these are the glutes, you know, and then they hold it. I would resist putting heavy bands on for someone whose hamstrings are firing before their glutes. You know, because if you go for power, you can relax it down. If you go for power and strength, you lose the stability and the motor control piece that you really want to gain from that person first. So you can do that. You can just do glute bridges. Let's go into your back real quick. And for the glute bridges, the first thing you want to do is the pelvic tilt. So a lot of times, yep, you get that pelvic tilt first, and then after you get the pelvic tilt, then you have them lift their hips. Yeah. in there. You want to maintain that straight line, that pelvic tilt while coming up and down. So then come back down, and then she said, yep, you said you have to reset. So let's not need to reset this time. So come up. Yeah, it doesn't feel like you're coming up as much, but you should feel it more in your butt this time than you did last time, and then come back down. Nice. And the same thing, if we're going after stability, we hold at the top of that movement. If we're going for power, we can just, load it. But we want to gain stability before we gain, power in there. So that's what we want in here. We're just trying to engage, get more glute activation in there. Other things you can have them do is how do you say it? Lateral band walks. So you can put the mini band around their knees and then just have them go. The key though is maintain, one second, I'll show you. So you have a set of bands. I should have did it to Shekinah, but I'll do it to myself. So you have a set of bands, you have them go above their knee, and where you want them to start is not with their feet together. You want them to start with their feet just about hip width, maybe even at shoulder width apart, so that the glutes are already kind of turned on. And from that position, you want them to maintain straight toes. Can you adjust that to make sure they can see my toes? So if you move forward probably and tilt. So, so you want them to maintain. What you'll see often with this client is as they go to take the step, it looks like that. So they want to slow down the movement, and it should be tension's already on the band. We're going to add a little bit more tension. See how small that move was? A little bit less. And so like this, like this. Well, this is what I see in the gym all the time. But this is not going to help them. If we want to get their glutes to fire, we have to teach the body that the glutes are on. So we got to get the band here, soft knees, right? That athletic position, and then step, 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 lift, and put it down. Don't let the band drag it back. You lift, and if you're limited in space, let's say someone's like, oh, I don't have a lot of room to do this in my home. What they can do is lift, down, lift, down. Just at this nice little pace that I'm doing right now, and I begin to feel it. If they start feeling their hamstrings, that's showing them their hamstrings are firing, and you just want to make sure those toes are pointed straight so they don't have that turnout, because that's the piriformis that's causing that foot to turn out, and also a couple of, well, we're not going to go that deep, but, what you're looking for is the toes to stay straight with those banded sidewalks. And then the last thing is wall angels, right? You get this person onto the wall, and you want them to tuck their body so that their lower back can be on the wall. So lower back's on the wall, head's on the wall, chin is tucked. So it's a really tough position. If you look, my feet are not near the wall, but my everything else is. And from this position, they go up. And they really got to work on their breath. Inhale all the way down. But they want to keep their elbows and hands against the wall as they go up. If you really want to challenge them at the top of the movement, you have them breathe and get some more. But the goal is keeping that lower back there, core engaged, shoulders and head touching. Great exercise for them to get that core stability. So a little bit longer video, but hopefully you can go back, grab some of these things. You don't have to do all of them with a client. I just want you to understand, hey, my lower back hurts. If it is a QL problem, here are some solutions you could use. And then as you guys have questions in our get-togethers, we'll create more content to help support you. Talk to you guys in a bit. Bye-bye.